first of all, I would like to say that I'm not a therapist and I'm not a direct caregiver, but mental health has become an important topic in both my personal and my professional life. So if I go from my close environment, I know people like dealing with conditions such as depressions, ADHD and autism. And I've become more observative on attending these behaviors and the emotional needs that these people have. Professionally, though, I've been working on an Erasmus project before called Inclusive Minds, where the aim was to support and spread awareness about mental health and the integration challenges that women may feel due to this issue. So this experience gave me deeper insight in how mental health affects everyday life and how to communicate more effectively around this sensitive topic. Even though that I'm not a direct caregiver, as I said, through observation and through my work, I can say that I'm aware of the emotional toll caregiving can take. So common signs you can identify is like the emotional exhaustion and the withdrawal the caregiver can feel, the constant fatigue or sleep issues, like they are not sleeping properly, feelings of helplessness or the feeling of being overwhelmed, irritability and mood swings. They are losing interest in personal activities and they have difficulties in concentrating. So this sign usually being unnoticed, especially by caregivers by themselves, until it becomes really severe. So the strategies that I would recommend to prevent them is, because the prevention is the key, and based on the work again that I have done in the projects and general awareness, like to create safe space, environments there where people can feel heard and can open up without the fear of judgment. Building community encourages participation in different group activities or peer support networks that can help reduce this feeling and the isolation. Empowerment through education and inclusion, like helping caregivers and those that they support, of course, to engage in a meaningful work or learning to build confidence and resilience, and encourage, of course, to take breaks and balance the life, like rest and self-time are not selfish many times as people think, but they are really necessary to continue. Professionals now, they can support also caregivers, of course, firstly by educating them about the mental health conditions and in a non-technical and easy accessible way. With that I mean also like information in different languages that can support other parents or other people that they may not understand the current language that in the country that they are living. Also providing space where caregivers can express their challenges, they can talk freely. Maybe the professional can involve the caregivers when they are creating the plan, so they are together building it. Offering culturally adapted services, especially for marginalized groups that is not easy to reach. And of course, the most important, I believe, is to normalize the idea that caregivers also need care. For the first, we would like to say that stigma usually comes often from misunderstanding and a fear that they affect both individuals with mental health and challenges, and of course they support network. So some main ideas to include is like that maintain stigma is the same and silence, and this is the feeling that the mental health should be hidden, we shouldn't talk about it. And then is the blame, that assuming that it's someone's fault that that person or they are going through this condition. dismissal, like is that viewing that mental health is not as valid as physical health, and of course the isolation that caregivers and patients feel excluded or misunderstood by their communities, by their families, so they are isolated. How you can manifest is like people may hesitate to talk about their feelings openly. Individuals might avoid seeking help of fear of being judged, most importantly. Caregivers also may feel invisible or unsupported in their roles as a parent, as a partner. Social and professional opportunities might be limited due to mental health related assumptions or biases, so it's also something that we should address. If I could give a message, I would say like it's okay to talk about it. It's a really simple phrase, but it usually opens the door for communication and conversation with people. And reassures others that vulnerability is not a weakness and that mental health deserves the same openness as the physical health. Another powerful tool is the öpponer symbol. It's really in a Swedish concept, but I think also has becoming more international nowadays, which is a simple visual symbol. Showing like with that you can show awareness and openness that it's okay, I'm aware of mental health and I'm open to discuss if you want it. And it's very, this kind of symbol can help break the silence by creating visible alliance in workplaces, communities and everyday life. Then maybe sharing real life stories is also a message, like using this, humanize this, the issue and break down the barriers. And encourage an exclusive language, like a positive representation in media and education, because it's something that is not addressing properly in media. How could we empower caregivers now is like by providing to fight the stigma is by providing education and training, of course, that to help them feeling confident to speak about the topic or the issue. Creating platforms for them to share the stories. Encourage support, peer-to-peer support. Recognize and validate their efforts that they are actually trying and publicly to point it out. And I think the most important of all is to normalize that their needs, like to highlight that caring for themselves is also part of caring for others. It's not a selfish issue as I mentioned before. One lessons I have learned about the importance is like through the projects and from my interactions, I've learned that the visibility is crucial. That when caregivers' contribution are acknowledged, they feel also valued and less isolated, and this can reduce the burnout actually. Others are more likely to step up and support if people are talking about it, and it becomes easier to advocate for resources and policy changes. I would like to say that also when it helps with the shift the narrative form from being a silent burden to shared responsibility, making their work visible also invites a broader conversation about mental health and community support, especially in marginalized groups like women, migrant women, or others that face unique challenges.